Much, and thank you very much for inviting me to speak this evening. So I'm the acting chair of the Hazards campaign, and I'm really pleased to continue our support for the important Zero COVID initiative. From the beginning of the pandemic, we knew bad employers. From before the pandemic, we're always going to continue to put profits before people and put lives at risk during the pandemic, unless the government ensured that workers were protected. Many workers had to continue to go out to work in the most dangerous circumstances without precautionary approach taken to controlling their health risks. It's a legal, enforceable duty, but the government have placed thousands of workers at risk because health and safety law hasn't been enforced properly, and more than 15,000 workers have died from all different occupations, but huge numbers in the health and care workers. Bus drivers, teachers, cleaners, porters, railway workers, food workers, meat processing workers, workers from all different occupations that have been exposed to unnecessary risk and infected with COVID-19. And many, as I said, have sadly died, but many more thousands, as Gabriel said, have been left with long COVID and unable to work. We worked with Independent Sage early in the pandemic to produce the COVID Safe Charter, and nothing's changed throughout. Transmission routes were known then, and they continue to be known now. It's an airborne disease. It needs, as Gabriel says, better ventilation in all our workplaces and inside spaces. We need to continue to distance, which they've just rubbed out. We need to continue to have space. We need less people and less in spaces for less time. We absolutely need a precautionary level of masks. And strong trade union organisations prevented many more from being infected. Before the pandemic, you were twice as safe if you worked in a trade union organised workplace. And throughout the pandemic, lives have been saved because our trade union organisations, trade union safety reps, have stood up to be counted. There have been continued successful actions taken by trade union members and their reps in challenging unsafe working conditions. Fantastic action, which has included strikes, work to rules, the successful challenges used in Section 44 and Section 100 of the Employment Rights Act by the NEU and Unison and other trade unions. If I can say one thing you need to do now more than ever is join a trade union, because despite all this, our new health minister has ignored all the warnings, has set us on a dogmatic path to removing all the public health infection controls needed to prevent transmissions in our workplaces. And workplaces include schools, buses, shops, offices, etc. They've left it up to the bosses to decide what happens to us. So what could go wrong? Well, we know care home workers have been told us that they've been told that they can't take any more time off work or they'll be dismissed. Teachers told not to wear masks in school. Bus drivers told not to wear masks, but to wear not to wear anything. Office workers told to attend workplace regardless of any underlying and chronic health conditions without any additional risks controlled. Office workers told to attend the workplace regardless, as I said, of underlying chronic and health conditions. Workers all over the country are abused and accused when they try to commit their employers to carry out their legal duties to control the risks from infection. And where's the new health secretary or the prime minister? Well, we know they're isolating, aren't they, with COVID-19. You couldn't make it up. Transmission risks are skyrocketing, and with them are hospitalizations, long COVID and death. Young people barely vaccinated, encouraged to hit the nightclubs that many of them work in. But in 5 weeks' time, they'll only be able to go to them if they're double vaccinated. It goes from bad to worse. Still, many workers have not seen an updated risk assessment throughout the pandemic. Still no precautionary standard of PPE, even health and social care workers. No enforcement, and employers hiding the numbers of people infected in their workplaces, and not even investigating any infections in the workplace. These are firefighters. These are trade union organised workplaces that we know about. Firefighters, school staff, university staff, etc., are being told they can't see the numbers of people that are infected or where they're being infected. We're having a protest next week on the 27th at the Health and Safety Executive Offices at Bootle and the Department of Health in London about making FFP3 standard masks available for all health workers. It's important. They reduce the standards and we've exposed our workers. We desperately need a zero COVID strategy, one that controls the transmissions in our communities, in our workplaces, and in our homes. Join this campaign. It's really important. If you aren't already involved, get involved, write to your MPs, donate to the campaign so we can do more work. We know what's needed to control transmissions of the virus in all our settings, and only those settings that control it should be open now. Our employers have a legal duty, as I said before, to control the risks through risk assessments, make sure they've got one. And if they haven't, report them to the HSE, report them to the enforcement authorities. The route we are on will not lead to herd immunity, as some people suggest, will not prevent death, and it is more likely to open us up to attacks by new variants, which will cause more harm. All around the world, public health professionals are in total astonishment at the UK, and many in agreement that the UK is on a murderous path. Finally, we need all UK nations to play their part, but this can't be just a national or a UK-wide fight. It has to be a global fight for all our health's sake. Thank you.